What's up, guys? Gonna be answering the Ask Me Anything questions that I posted on the DPT students page the other day. I'm just gonna go in order of the questions that I got. Number one from Eric Williams: Do I even lift? Bruh, do I even lift? Come on, man, you know the answer to that question. Number two: Why do I wear my little brother's shirts? From Mike Connors. Because you don't pay me enough to buy my own shirts, man, so I have to borrow everybody else's, and sometimes they fit, sometimes they don't. Number three: How much do I use mindfulness and meditation? From Cameron. I actually use mindfulness and meditation practice quite a bit for people. A lot of people look up, there's different iPhone apps, or there's YouTube channels, or there's podcast channels that you can actually go through guided meditation and mindfulness. And for people that deal a lot with stress or anxiety, or they have a lot of psychosocial factors that may be playing a large role in their pain, I will definitely recommend that stuff to people. I don't spend a ton of time in clinic doing that with them. Maybe on the first visit or two that we bring it up, we practice some boxed breathing, or some focused breathing, or a little bit of mindfulness, or kind of I do the hand open, close kind of meditation approach pretty often in clinic. But I want people taking that home and using it for self-management on their own when they feel like they need it, before bed, when they're in pain, that sort of thing. Number four: What was my experience like writing with the Physio Network? From Blake. Awesome experience. The guys at Physio Network are super good. Tim Rowland, Niels, all those guys. Awesome guys, really doing a great thing and putting out an excellent product. I mean, it's not very frequent that you can get a bunch of big name physios all together, writing research reviews, doing things that are recently published, and condensing that down to 750 words or less, and sending it out in a really slick, sexy looking monthly mailer that gives you 12 or 15 research reviews every single month for essentially the price of a Starbucks coffee. So I had a great experience with them. I'm going to keep writing with them because I think that the product that they're putting out is really great, and I stand behind what they're doing. My favorite analogies to use for pain, from Jim Hefner. It's a great question, Jim. Use a ton of analogies. I probably have 40 or 50 or maybe even 60 different analogies that I roll through with different people for different scenarios. And I'm actually in the process of putting together a resource for clinicians, a book all about analogies that I use in clinic with people that are in pain, or that are injured, and that need graded exposure or progressive overload, or different analogies for movement and that sort of thing. But I think you know that because, Jim, you are my partner in this project, and I'm looking forward to where we take it and releasing that in the coming months. So how do I explain muscle tightness? From Alex. So great question. Usually I explain muscle tightness as it's a sensation, and a lot of times that muscle tightness isn't actually a limitation in range of motion or physical tightness in the muscle, but it's similar to if they were to feel warmth or cold or vibration or pressure or something like that. Feeling muscle tightness can be just the same as that. It doesn't have to be an actual limitation in a joint's range of motion. So I often describe to people that muscles are the employees and the nervous system is the employer. And when the employer tells the employees to do something, they usually listen. And the employees are always just doing what the employer is telling it to do. So if the employer, the nervous system, tells the muscles to be or feel tight, they might do a little bit of protective guarding. They might alter their EMG or resting electrical activity, as some studies show. But it could also be a perception of the central nervous system that creates the sensation or the experience, the lived experience of feeling tight. So I like to use the employee and employer model for explaining tightness or muscle tightness to patients a lot of the time, or just protective guarding. If their nervous system thinks that something is going on, if they think that there's a lion in the room with them, they're probably going to tighten up a little bit or be less fluid and careless with their motion. So they might have some tightness as a protective mechanism. And then final question, how is direct access coming in Texas? From Douglas. Terrible. It's not coming. We still don't have direct access. I can evaluate a patient, but I cannot treat them. If they roll their ankle, I can say, wow, you have a sprained ankle, but I can't even tell them to put a hot pack on it or an ice pack on it or elevate it or to do this or to do that, to do ankle alphabets, because that would be treating a patient or giving medical advice without a prescription from a physician, which is mind-blowing. I can get a prescription from a PA, from a nurse practitioner, from a chiropractor, from a physician, from a dentist, and guess what? Then I can treat that patient, but I'm not allowed to evaluate that patient on my own, but they can see a massage therapist or a Pilates instructor or a Reiki practitioner, any of these people, and be treated right off the street without any medical screening, without any physician, blah, 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 blah. And this isn't just an insurance thing. Actually, a lot of the insurance companies don't care about a physician signature on the plan of care. This is literally a state law thing. So even if I wanted to treat people cash money or even for free, I couldn't do it. And Texas only has legislative session once every 2 years. So we've got to wait for another year and a half pretty much until we can actually go after this again, or almost a little over another year before we can go after this again, trying to get the whole direct access laws changed. It's very frustrating, and it's a hot button issue down here, and it's not like we're not doing our part. We're just fighting a very, very powerful medical institution that wants to restrict the amount of freedom and autonomy that we have. So that's going to conclude the Ask Me Anything questions. I'll be posting another post soon on the Ask Me Anything questions, and I hope to see more of you guys post a lot of good questions out there. I appreciate it. You guys have a good night.